Thank you for inviting me to speak today, and thank you everyone for joining. I will be discussing high blood pressure in pregnancy as well as preeclampsia. And I would like to emphasize that these conditions are really important. We see them every day in obstetrics, and these are important because they have a potential impact on the mother as well as the baby's health. Could you please move on to the next slide? So, as I mentioned earlier, it's a very important topic. That's because initially it can appear as, very subtle, and you won't even know unless a woman deteriorates completely. So, early recognition of a high blood pressure or preeclampsia is very important in pregnancy. The next slide. So, I'll now tell you how do we define high blood pressure in pregnancy. When the blood pressure goes higher than 140 over 90, then we call it as a high blood pressure. And in pregnancy, it has different types. One is known as the chronic hypertension. The other type is gestational hypertension, and then is preeclampsia, and then eclampsia. Preeclampsia can, if not treated on time, it can develop into a condition which is known as severe preeclampsia, and then it can lead to very serious risks, including a seizure, even the death of the baby or the mother. So it's very important to treat them on time. And I would like to tell you in the next slide that how do we differentiate between the hypertension induced in pregnancy and what is preeclampsia. So, gestational hypertension in pregnancy is high blood pressure without any signs of organ damage. So, when we say it is preeclampsia, it means that you will start to see protein in your urine, you will see abnormal blood tests, and then that is a sign of organ damage. It affects the kidneys, the liver, the brain, it affects the placenta, and it causes damage to the blood vessels and the organs. And it usually develops after 20 weeks of pregnancy. And did you know that preeclampsia is not just high blood pressure? As I mentioned earlier, it is a disease that involves the whole body. So don't forget to attend all your antenatal checkups and your blood pressure and your urine checks because early identification can prevent the formation of any serious complications later. So in this slide, I'd like to tell how preeclampsia actually develops. There, we don't know what is the specific cause of preeclampsia. However, um, it is stated that it is related to placenta. The placenta does not develop normally, and then that results in abnormal blood flow and abnormal blood vessels, and then and then the placenta releases a substance that goes through the into the mother's bloodstream, and then it can affect the brain, the liver, the kidneys, and lungs as well. And then that results in complications in the mother. So there are women who are at a risk of high blood pressure and preeclampsia. There are the risk factors include the first pregnancy, if somebody is having a multiple pregnancy, for example, twins, if somebody had preeclampsia in their previous pregnancy, diabetes, somebody who is known to have high blood pressure. Obesity is also one of the major risk factors, and also very advanced maternal age. We consider it as 45 years and above. The symptoms that you should be aware of when you're pregnant are severe headache, blurred vision, flashing lights, swelling in your hands, on your feet, on your ankles. If you feel severe upper abdominal pain, especially in the epigastric area, when you feel that the baby's movements have started to reduce and you feel sudden breathlessness. So these are the symptoms one should never ignore when you're pregnant. And as I mentioned earlier, that it can appear very subtle in the beginning. So some women may have no symptoms initially. That's why antenatal checkups are really important. Severe hypertension is defined when the blood pressure goes till 160 over 100 or above. And it is a very dangerous condition and it's a medical emergency because there is a very high risk of stroke. The brain, there's a lot of swelling that develops on the brain tissues get affected, and then that can result in seizures. It can also damage the organs to an extent that it could result in an organ failure. And then it can also lead to a very serious condition which is known as placental abruption, in which the placenta detaches from the uterine wall, and then that can cause a lot of pain and severe bleeding. So that has to be treated on time. Um, The mother can develop a lot of complications, as I mentioned earlier, the organ damage. It can affect the platelets in your blood and also your liver function tests. It can affect the kidneys very badly. It can cause accumulation of fluid in the lungs. And then also, it can result in a very serious condition, which is known as disseminated intravascular coagulation, where small clots form in your bloodstream, and then that can also result in a massive bleeding. So complications can develop rapidly without warning. That's why make sure that if high blood pressure is diagnosed at any point, it is monitored and treated. Because there is abnormal blood flow to the placenta, obviously the placenta provides nutrition to the baby. It supplies the blood flow to the baby, gives nutrients and oxygen. So when the placenta is not working normally, then there are definitely risks to the baby that include prematurity, growth restriction, and even stillbirth. So, to avoid all these complications, it is very important that blood pressure checks should be done. The severity of the condition basically depends on what gestation in it. The monitoring depends on the type of gestation and the severity of the condition. So, make sure that you come regularly for the blood pressure checks, the urine checks, and we see the blood tests, and we also do the growth scans and CTGs uh, to assess for the baby's well-being. So here I would like to mention a few principles that can avoid pregnant women into getting into this serious condition. The blood pressure should be controlled and it should be monitored closely. The mother should be monitored closely. The baby's well-being should be assessed on time, and even if required, early delivery wherever it is needed. And we treat the condition with a few medication, including the names mentioned here: labetalol, nifedipine, and methyl-dopa. These are some of the common medications that are given to the pregnant women to control the blood pressure. So, as I mentioned earlier, early antenatal care is very important. We have to identify who are the high risk women. And once we find somebody who's at a high risk of having preeclampsia in their pregnancy, we start them on low dose aspirin, and they should come to the hospital for a regular follow-up. So the take-home message here is high blood pressure in pregnancy should never be ignored. And if it is not treated, it can develop into a serious condition which is known as preeclampsia. And if preeclampsia develops, it can affect multiple organs. It can result in organ failure. It can result in seizure. So early recognition is really critical. And once it is recognized on time and interventions are done on time, then the outcomes improve significantly.
Okay. So, thank you.
And
Oh,
I'd like to also mention the fact that the women who are diagnosed with eclampsia in their pregnancy, they do well, but they do well only if it is recognized on time and steps have been taken in time to avoid any complications to develop?